Now we're gonna learn how to perform a second trimester screening with prenatal screening cloud. In a previous video we have seen how to perform a first trimester screening test, and now we'll learn how to perform a second quarter test. We enter in the app with our email and password facilitated when we have registered. Once we are in the app, if we want to begin a new screening, we click the button New and select the type the test that we want to perform, a second trimester, and then we click the button Create Screening. It appears a screening form that we should fill to compute the risk of aneuploidy. As we seen before, the screening form is structured in various sections. The first section is called Patient Screening, where we define a screening code that allows us to identify this screening, the screening date. If we click, it appears by default the current date that we could select. The date of birth, where we must enter the patient's date of birth. Below it we got the option Race, Ethnicity, where we can define patient's ethnicity, because some ethnicities have a correction factor associated that modify the MOM of biochemical markers. And finally, the weight of the patient that modifies the MOM values of biochemical markers. The following section is Pregnancy. We can report about the smoking habit. If the patient suffers from insulin-dependent diabetes, or if an ovulation induction has been done, because all these three categories in case of a being affirmative. A correction factor is applied. In the case that the ovaries from a donor are frozen, we must enter the age of the donor at the time of donation, or the age at the frozen date. If it is a twin pregnancy, we should define the placental type, monochorial or bichorial. The next section is Blood Test, where we should enter the values of the biochemical markers. Here, depending if we perform a double, a triple or a quad test, we should report 2, 3 or 4 markers. Also, the program allows to use free beta HCG, a total HCG plus beta fraction. In all markers we can select which units are we going to use, as well as the brand of the reagents. Also, if we have the MOM of the biochemical markers, we got the option to use them. However, we recommend to define these parameters at the time of the account configuration. In this tutorial we perform a quad test with AFP, total HCG plus beta fraction, non-conjugated estriol and inhibin A. Then we should enter the blood test date, that can be the same as the screening date, or other date. If the markers are measured in different dates we can specify them. After filing the biochemical data, we enter the data corresponding to the ultrasound section that allows to report data regarding the scan exploration. We can use the different biometrics to compute the gestational age, biparietal diameter, femur length, or head circumference, then the ultrasound date, that can be the same as screening date or not. There is a checkbox called Show Extra Markers, and if you click on it appear a list of dichotomous markers that we can report if they have been assessed. At the bottom of the screening form, we find at the left side a section of previous anomalies that will help us to inform if the patient have had a previous pregnancy with Down syndrome, Edwards-Bartow syndrome and neural tube defects. At the right side there is a section called Optional Gestational Age that facilitates different ways to compute the gestational age if the biometrics is not reported. Entering manual gestational age in days and the date. Or we can use the last menstrual period of the conception date. Finally we click the button Save Changes and automatically the risks will be computed. At the right side of the screen, if we have entered all the necessary data, the risks computed will appear. From top to bottom we can observe the following data, risk positive and negative for a cutoff 1 to 250. The risk computed for trisomy 21, trisomy 18/13, open neural tube defect, and the risk for maternal age. When the risks are negative are shown in green color. When they are positive in red color, and the maternal age risk is always displayed in yellow color. Then we may observe the computed MOMs for all the Gaussian markers used. There are the values of each marker, and the corresponding MOMs for the respective gestational age. Then we find the gestational age at the screening date and the expected date of birth, the correction factors that have been applied in this screening, and finally the button, Generate Report. If instead of a quad test, we want to realize a triple test, we click the Edit button, we delete the inhibin A value. We save the changes performed and the software computes the risk for a triple test. And if we want to perform a double test, we repeat the action and we delete the non-conjugated estriol value. If we click the button, Generate Report, automatically appears a frame that allows us to add additional information that will appear in the printed report, as the name and surname of the patient and the possibility of screening comments. After, we can click the button, Download Report, and the report in PDF format will be created. If the report has been generated correctly, appears a message advising that the report has been downloaded successfully, and we can check the download folder of our browser. If we open the report, we can observe that collects all the information about the screening. At the top right of the report, we find the header title, the head subtitle 1, and the header subtitle 2 that we have defined at the time of configuration our account. Then we will find the results of this second trimester screening test in order. Firstly, we find the patient's data, name, surname, screening code, date of birth, ethnicity, weight, screening test date, and the correction factors, smoking, diabetes, and ovulation induction. At the right side, the blood test data, their values and the blood test date. The ultrasound data, biparietal diameter measurement and ultrasound date. Below there are the screening results, the MOMs of the Gaussian markers, data relating the gestational age and the expected date of birth, and finally the risk for trisomy 21, the risk for trisomy 18/13, and the risk for neural tube defect. The risks are shown as positive, negative, in numeric format and with a graphic representation. Below the risk appears the screening comments that we could add when generating the report, as well as another comment indicating that this is a statistical calculation and has no diagnostic value. At the bottom right we'll find the signatory doctor defined at the moment of the account configuration and the report date. We have observed how to perform a second trimester screening and the corresponding printed report with Prenatal Screening Cloud app.